Staying with the pandemic now, and the last few months have seen a worrying rise in the rates of pregnant women hospitalized with COVID-19. New data from the United Kingdom shows that 1 in 6 of the most critically ill patients are unvaccinated expectant mothers. Inoculation rates among mothers-to-be remain low, with conflicting information fueling fears.
UK resident Kelsey Rounce was 29 weeks pregnant when she got sick with COVID-19. Doctors induced a coma, and when she woke, her son had already been delivered. She hadn't gotten the coronavirus vaccine.
If anyone was told that they would be put into a coma and potentially dying, I think you'd probably consider it a lot more. I think I'm going to get it now.
The UK's National Health Service says unvaccinated pregnant women now represent 1 in 6 hospitalizations due to COVID-19. Claire Bromley was also hospitalized with the virus and told she might have to deliver her baby via C-section at only 26 weeks, a dangerously premature age for delivery, one that can carry long-term consequences.
I thought I was going to die, and I thought he was going to die, and we waited so long for this family that was the greatest fear, that my husband was going to lose us both.
Now that they're both safely out of the hospital, she's urging other expectant moms to protect themselves against the virus. Pregnancy can be a confusing time with an abundance of opposing advice. Guidelines around the coronavirus vaccines have been no different, with some countries recommending the shots for moms-to-be and others advising against them. That's partially because pregnant women were excluded from vaccine trials, as is standard practice for most medicines. Now, a growing body of data shows the benefits outweigh the risks for expectant mothers.
There is a risk that you may get a more serious form of COVID. You may be admitted to the hospital. You can have the vaccine at any stage during pregnancy. We've got increasing amount of data that tells us that it does not increase the risk of miscarriage. It does not increase the risk of stillbirth.
With the failure of medical science to send a clear message to pregnant women, there are growing calls for them to be included in the future of vaccine research.
We're joined now by Dr. Birgitta Strizek, who's with us now. She's the head of the birthing center at the University Hospital Bonn here in Germany. Dr. Strizek, thank you for taking the time to speak to DW.
Hello, good morning.
Now, the general medical consensus is that pregnant people should get vaccinated. Explain to us why this is the advice being given to patients.
We have seen from the beginning of the pandemic that if pregnant women get COVID, they have a higher risk of getting seriously ill, and this has been even more pronounced during the last Delta surge. So within the last couple of months, we have seen more and more severely ill patients that had to go to the ICU, had to be ventilated, and this has a very high risk for mothers and babies. So it's very important. And we advise all women who want to get pregnant, are pregnant or breastfeeding to get vaccinated as soon as possible.
I suppose some people might wonder, why are pregnant women at greater risk than perhaps the rest of the general public of getting seriously ill when they were to contract coronavirus?
We really don't know why that is so and why the Delta variant of the virus makes this risk even higher. And it does have to do a little bit with risk factors. So if you're an older mother or severely obese, or you already have a lung disease, you're at even greater risk. But just being pregnant, especially in the last trimester, more than doubles the risk to get seriously ill. And that's why it's so important to prevent the severe illnesses. And that's what the vaccine has been shown to do. And we have more data now. We have a lot of data, actually, that it's safe to get the vaccination during pregnancy.
And then, are all vaccines suitable for pregnant women?
At the moment, we have the most data for the mRNA vaccine. So that would be Pfizer, BioNTech, Moderna. And that's why they are recommended in pregnancy. We don't have much data on the other vaccines.
Now, perhaps the biggest concern some have is, how will the vaccine impact the baby, the unborn child? What do you say to your patients who come in and say, I'm actually really nervous about getting the vaccine, and how do you ease their fears?
We get those questions a lot, and what we see is that if the mother gets seriously ill, that is also a very high risk for the baby to be born prematurely or even dying during pregnancy. So it's important that the mother stays healthy, and we do have a lot of data that in the pregnancy the vaccine is not dangerous for mothers or babies.
Now, there is a lot of fear and confusion. You know that better than anyone, being a doctor yourself. What needs to be done to get the message that's backed by science across to the people?
We get those questions a lot, and it's very difficult, but I think it's important that in Germany, for example, STIKO now has recommended the vaccination for pregnant women, as have many other countries, and I think this will help to inform patients and to get the message across why it is so important and it's safe to get vaccinated in pregnancy.
Dr. Brigitte Strizek from the University Hospital in Bonn, thank you very much for your time.
Bye-bye.